Rao, Father, and Mr. Krishnamurthy for giving me this opportunity. The topic is dementia. In 2018, there were 50 million people with dementia all over the world. That number is going to be 150 million by 2050. The fastest growth rate is in China, India, South Asia and Western Pacific regions. 3% of people above age 65 experience dementia. But that percentage goes up to 30% when you are over 90. Dementia refers to either a defective formation or recall of memory. Memory is essential for our adaptation and survival. Each time the brain gets an input, it interfaces with what is in the memory to see the importance of the new information. If it is not important, it is not stored. If it is important or if it creates an emotional attachment or content, then it will be stored. The storage can be based on strengthening the existing connections between the nerve cells or creating new connections. So when the time comes, the brain can access it. The storage has to withstand the ravages of time and interference and should be retrievable for us to use. Dementia is when you have that problem, either storing it or recalling it. There is no blood test to diagnose dementia. It is based on clinical symptoms such as personality changes or language difficulties. There is a confirmatory test of brain scan, but that is progressive. Some people may not have it in the beginning, some people may have. This is the brain scan of a normal person. You can see there is not much area between the bone and the brain, and these white spots are water-filled spaces, and this is the brain matter. Now, this is what happens in dementia. You can see the gap, this more water filling. This is the damaged nerve area replaced by scar tissue. So this is what can happen. Unfortunately, you may not see this in the beginning because the shrinkage is there. Not in every person it progresses. So doctors classify dementia into two groups, one with Alzheimer's and one without Alzheimer's. The question is, which starts first? The difficulties with memory or the cognition defect or the shrinkage? And right now, nobody knows. So what I'm going to do is to make a case for the Alzheimer's disease to be due to functional defect inside the nerve cell, damaging or making the nerve cell useless, and it atrophies or dies, and that later causes the shrinkage. And in people without Alzheimer's, I'm going to make a case that the shrinkage comes first, and that it leads to the cognition or the behavioral difficulties. Now, why am I saying that? Let us take Alzheimer's. 65% of people of Alzheimer's have diabetes, or diabetes can lead to Alzheimer's later on. So there's a strong connection. And what is the reason? When your blood sugar level is high, there is increased blood sugar in the fluid around the brain as well as inside the nerve cells. Sugar molecules have a tendency to be attached to proteins. The common test A1C is a measurement of the percentage of attachment of glucose to hemoglobin. In animals, they test the percentage attachment to albumin, another protein. It's a very common feature. So when too much glucose molecules are inside the brain, it can get attached to proteins that the nerve cells commonly use for transportation, for construction of things inside. By the way, each nerve cell has different functional units, and they all need these protein. In order to provide the materials needed for construction inside the brain or inside the nerve cell, there are transportation ways, just like roadways, but these transportation ways are based on strings. It crisscrosses the nerve cells. And there are tiny motors of protein that carry the material from one place to another. If the construction of these roadways, for the construction, if they use a protein to which the glucose is attached, then the protein cannot be shaped at the right way. They call Alzheimer's a protein deformity, a folding deformity. So if you make this roadways with a defective protein, it's going to break. And that makes it difficult for you to access information. And eventually, that broken proteins will form clumps called the plaques. And this can be diagnosed only after you die or after your biopsy. So there is no test. So this is why I make it difficult. More and more scientists are saying dementia is caused by Alzheimer's, which is understandable because the incidence of diabetes is increasing all around the world. So, what I am suggesting is the defect starts inside the nerve cell, then the nerve cell dies, then the whole thing starts shrinking. So later on in Alzheimer's, you can see the same level of shrinkage, but not initially, because the structure is fine. Now, I'll come to dementia. I'm separating dementia, that is those without Alzheimer's. Why should they have dementia? Here I'm proposing the shrinkage comes first, then it leads to the functional defect. In order to understand shrinkage, you need to know something about water. 80% of the volume inside a cell is occupied by water. But in that water is suspended the factories, different organelles. The construction place, some dismantling place, energy production, and the fibers that allow for transportation, all are suspended. It's more like a soup. The nerve cell produce about 2,000 proteins per second. Can you imagine the speed with which it has to happen? 2,000 proteins per second. For that, materials have to be moved so fast from one place to another. There are carrier proteins which carry each molecule from one place to another. How can they carry it with such speed? Take it, move it, detach it, then come back. It is done by the use of water. Each water molecule, if this is an oxygen atom, H2O, 2 hydrogen atoms and 1 oxygen atom. That's water. Whereas these hydrogen atoms will connect with the oxygen and stay there only for 1 to 20 picoseconds. That is 1 trillionth of a second. It's gone. So that force allows the protein to attach to a material, move it, leave it, move it. So water concentration is so important for the cell function. Imagine what will happen if the water is drained out. Water concentration inside the cell is maintained by the amount of sodium, which is salt, sodium chloride, sodium part. Each cell spends 1/3 of its total energy production to maintain the sodium level inside the cell optimum. Because if it is not optimum, it destroys the cell function. What can disturb this concentration? Water moves from a low sodium area to a high sodium area. The cell can push out the sodium inside, but the cell has no control over sodium outside in the environment. So in the brain, the fluid contains more sodium, it will draw water out of the cell, and the nerve cell shrinks. And that shrinkage then you can see in the brain scan. So this then makes the function of the cell difficult. So to just show you the importance or the significance of this, I have made this. I just did this morning. This is plain old cucumber, and they both had the same volume, 1.5 pounds, which is, our brain is about 3 pounds. So I put half each. This one, I added 1 tablespoon of salt. They were both done this morning, about 2.5 hours ago. You can see the shrinkage, and if you can, see whether you can drain the water. See how much water will come out. You can use that lid as a drop, stop, drop, okay, and see. Okay, there's practically no water. Okay, Now try the other one. All of it. Yeah, all the water.
As a result of this salt.
Anybody has any doubt what salt does to this? It may not be exactly correct what happens in the body, but that is what I wanted to show you was the power of salt to draw water out of a cell. So this is what it's a question of quantity. This one is the salt. The water came out, so the whole thing. So the same thing can happen for your nerve cells, causing, instead of the nerve cells being like this, it can go shrink and become small.
Excuse me. Reserve your questions after the lecture, please.
So the question is, once the nerve cells are damaged, you cannot recover it, because each nerve cell is connected to about 1,000 other nerve cells. All the connections are lost. Whatever is stored in the memory is gone forever. So the best solution is to prevent it from happening. And to prevent it from happening, it's not that difficult. That's my point. Because most of the glucose elevation comes from intake of grains and grain-based foods. Grains were never meant for humans, in my opinion, because otherwise we would have had beaks to pick them up and the ability to digest the chaff or the cover. We don't. It became popular because of the milling and refining. Salt is primarily in the pre-prepared foods and restaurant foods. What salt you use at your home, you have control over. And there was a study done in 2015. There is a neuroimaging study showed that people who consume the pre-prepared foods and restaurant foods started showing shrinkage of the brain even before having any cognition difficulties, any memory issues. So that starts first. Then a 2015 study showed, 2023 study showed about of 11,000 people, both white and blacks, those who have the sodium level at the highest of the blood level, 135 to 140, they had 65% higher chance of developing dementia compared to those at the lower end of the range. So by cutting back on grains, grain-based packaged foods with added salt, you can prevent both. Because there is no treatment. There are companies that will produce new nerve cells, but how can they know the attachments? They cannot reproduce the same attachments. So my request is, my major concern is children. How many of them are carrying the prepackaged snacks all around from morning, and if they are playing, they are carrying some, they are eating that. Once you get used to the salt content, the brain accommodates, because no matter how much salt you take in, your body wants to maintain the optimum salt content. Salt is necessary for absorption of complex carbohydrates. So the brain will encourage, once they get used to it, it will make you feel you want to have more and more salty foods. If your blood salt content is high, your salivary salt content is high. So in order for you to taste something salty, it has to be even higher. Otherwise, you don't even taste it. So, this food is not salty, but somebody who is not salt tolerant, this may be extremely salty. So each individual is different. The problem comes if whoever is making the food in the house, in the kitchen, if he or she get attached to salt, everybody else can suffer. And there may be one person who cannot tolerate that much salt, and that person will have the biggest problem. So these are things that we can do to avoid the shrinkage of the brain or the functional damage inside. And I thank you for your attention.